Dr. Reddy, I just want to bring to the knowledge of the public or the people who utilize gastrointestinal and liver services. Many times, patients are not aware of what are the services offered by gastroenterologists. Often they think it's only about colorectal cancer screening. The GI system is extraordinarily vast. It's one of the largest subspecialties in medicine where it involves the esophagus, stomach, small intestine, the colon, the liver, the pancreas, the gallbladder, the spleen. Given the enormity of so many organs, human beings can suffer from a variety of diseases. Hence, gastroenterologists who practice this particular subspecialty can offer a variety of services to improve the health of the public. Typically, a gastroenterologist who's trained does endoscopic procedures. Endoscopy helps in diagnosing disease and also helps in treating certain diseases. We do upper endoscopies when patients come to us with complaints of, for example, pain in the belly or abdomen, if they're having heartburn or indigestion, sometimes difficulty in swallowing, or the family history of certain diseases, for example, stomach cancers, etc. And patients can also have small intestinal diseases. So there are endoscopes, what we call as an enteroscope, that helps to look into the small bowel. Or we have what we call as telemetric capsule studies, where we do this capsule test if somebody is having anemia, unexplained anemia. Anemia refers to low blood count. The patients are having occult bleeding, means bleeding that is not seen to the human eye. And we need to investigate after doing an upper endoscopy and a colonoscopy. If we don't find the source, then we have to look into the small intestine. And that's where the help of capsule endoscopy or the telemetric capsule study comes into the picture. Then if you want to do something, if you find something on that study, then we use an enteroscope to go ahead and take care of the problem. With regards to colonoscopy, many of you are already familiar, probably most of you already had your colon cancer screenings, those are eligible. But colonoscopy also helps in detecting a variety of human problems. If somebody is having persistent diarrhea, somebody has sudden change in the bowel movements, somebody has unexplained or explained rectal bleeding, or colonic bleeding, or weight loss, sudden weight loss, or abdominal pain that has not been answerable for the variety of other diagnostic tests in certain age groups, or patients with history of diverticulosis, when they have history of diverticulitis, when we have to subsequently screen them for colorectal neoplasia. Or we also evaluate for inflammatory bowel disease, which is very important in the United States. And we do colonoscopies, and then we also get into the distal small bowel to diagnose diseases like Crohn's disease, and take biopsies and appropriately treat the patients. So the services of gastroenterologists encompasses more than 100 to 150 common diseases that we see in our day-to-day life. Apart from these diseases of the pancreas are very important. Patients who have unexplained weight loss, if they are in their 40s, 50s, or 60s, there's a possibility somebody might be having a pancreatic tumor. Or patients who have history of pancreatitis or develop new onset pancreatitis, one needs to identify the cause, whether this is secondary to, by any chance, increased alcohol consumption or presence of gallstones, or this is hereditary type things, or because of medications, or other reasons. If we diagnose these diseases appropriately at the right time, we can treat them and not wait till it leads to complications. Now, coming to diseases of the liver, most gastroenterologists do not practice hepatology, which is the study of liver diseases, unless they are very comfortable or trained. In our practice, all our gastroenterologists who are trained in liver diseases, like myself, who have spent my time at the Baylor College of Medicine, have been treating thousands of liver disease patients for the past 40 years. Patients with liver diseases that come to us A variety of problems simply on ultrasound, somebody picking up a fatty liver, or patients who have a history of hepatitis, or patients who develop hepatitis, which is inflammation of the liver that can happen from viruses like hepatitis B or C or even A, or patients taking certain medications that can cause to liver toxicity and develop jaundice, or patients who have viral diseases of B and C who can develop liver cancers. So these are, again, dozens of diseases and ailments which a gastroenterologist evaluates the patients in taking care of them, helping them with proper diagnostic tests and offering the right treatments, which is very important. So we at Digestive and Liver Disease Consultants for the past 40 years are very grateful to our patients for trusting us and giving this opportunity to evaluate them very thoroughly. Beyond what I just described, there are other many procedures which we do as interventional procedures. For example, patients who have gallstones in the bile ducts, we do this procedure called ERCP to take out the stones from the bile ducts. If they are malignant jaundice, we put stents into the bile ducts. We put stents into the pancreatic duct. If patients have esophageal tumors, by going to treatment, we put esophageal stents to help them swallow while they finish the treatment of either chemotherapy or radiation treatment, or sometimes as a bridge to surgery. Same thing happens with colorectal cancers, where we can put intraluminal stents for these patients and help them. So we are trained both in routine diagnostic procedures and advanced procedures, advanced interventional procedures, and all of these things which we're expected to do very safely with years of experience and help patients in both offering diagnostic and therapeutic services. I'm really glad I'm sharing this with you all for the simple reason this helps to understand when to go to a gastroenterologist, whether it's abdominal pain, excessive gas, or bloating, or constipation, or diarrhea, or weight loss, or difficulty in swallowing, or loss of appetite, or developing jaundice. Any of these problems really requires the attention of a good gastroenterologist in your communities and proper discussion, formulating a treatment strategy, and helping you to overcome this problem. Thank you.